Hey doc, what is this unexplained rash on my skin? I'm noticing just random rashes here and there. It just came out of nowhere. It looks different each day. Some days it looks dry, some days it's itchy, some days it's scaly. I don't know what is causing it. I'm just seeing random rashes on different parts of my body. Let's talk today about random rashes, okay, on your skin. And it's a very broad topic in the sense that different rashes can tell us different things about what's really going on. There are some classic rashes that we see that we know is caused by a virus. For example, the herpes family of viruses that causes herpes zoster or causes like shingles. We sometimes can recognize them based on the pattern that they show up on the body. But there's some other rashes that are just dry, scaly patches, like some we label them that they're like eczema, some we label them psoriasis, like that. Some are like yeast rash. And so we see different rashes, and we a lot of times we'll treat them with maybe some steroid cream because we really don't know what's causing it, okay? So today I want to share with you like 3 things that I usually look at if I'm suspecting that a patient is having these rashes, or this patient comes to me with, like, I call them random rashes or unexplained rash. So the first one is your gut health. Okay, what do I mean by your gut health? The immune system, our immune system lives inside of our gut. At least a huge percentage of it, we say even close to 60% of it, lives inside of our gut. And it was placed there because that is one big area where pathogens can invade our body, right? If you put dirty food in your mouth, for example, right? Bacteria, fungi, different things can get into our body through the gut. So the immune system right there will allow your body to attack those things before they can actually invade and do damage to you. So when we start seeing rashes on the skin, okay, one of the things that we have to think about is the immune system. So there's about 60% of it sitting in the gut. Well, another area where you find your immune system is under your skin. So maybe another 20% is right there under your skin, and then another 20% sits in your lungs, right? Because those are the areas where we get invaded, right? You get a cut, bacteria gets under your skin, or you breathe in the wrong hair or virus or bacteria, and that starts to invade your body through your lungs. So your immune system is smartly in those areas so that it can attack really quick. So when we see rashes on the skin, it can be a sign that your immune system is reacting to something. So we usually go to gut health because if your gut has allowed the pathogen into your body, right, because it's broken, it's damaged, or something is going on, then that would be an area that we can quickly work on, heal the gut so that those pathogens can stop invading your body. We can heal the immune system that's lying in your gut so that also the immune system that lives under your skin is probably also off, right? That's part of why you're seeing this invasion of your skin. So when we work on your gut, the immune system in your gut, we're also helping the immune system that's under your skin. We're also helping the immune system that's in your lungs to help you clear these rashes, right? So one of the areas that we also find is commonly the cause of random rashes are food sensitivities. And on top of that list is gluten. And a lot of people are now aware of gluten sensitivity and gluten allergy, celiac disease, and things like that. But a lot of people don't also think about the fact that dairy, for example, can be a cause of food sensitivity. We see patients that are intolerant to what we call GMOs or genetically modified foods. So we find that if we can take those out of the diet too, things like corn, soy that are genetically modified, that also helps your rashes go away. And then we look at also pathogens, right, as another cause of rashes. A lot of people are familiar with yeast and candida causing skin rashes. So we always look at those areas as well when we are trying to address what is this rash, where did it come from, what is it really? Is this really psoriasis? Is this something else? Is this a virus? Is this a bacteria? So those are the areas that we really have to pay attention to. So some patients will have to go on antifungals. Sometimes we use natural herbs to try to kill this yeast. Sometimes they have to be prescription drugs that are a little bit harsher on the liver. But if it's really severe, we sometimes have to do that, right? But those are areas that we definitely have to think about. Like when we see a rash, it's not just about putting corticosteroid cream on top of the rash to try to get it to like calm down. We need to think about why is the rash there? What is being attacked? What is going on internally that might be causing this rash to show up? I've had so many kids that have been told they have eczema growing up, and by the time I see them, like they have dairy sensitivity, they have like gluten sensitivity, and we just needed to take them off of those foods and the rash goes away. Okay, so those are simple things that we can do. We can look into what foods are you eating. Is there an overgrowth of candida in your body because of an imbalance? Maybe you've been on antibiotics for way too long and you've killed off all your good bacteria in the gut, and we need to replenish that using things like probiotics and replacing that good bacteria in your gut. Are you eating too much dairy, right? Some people love their cheese, they love their milk. But if your body is constantly inflamed, you're seeing rashes, you're constantly making mucus, you're feeling congested in your nose all the time, you keep catching multiple sinus infections. These are signs that your body is reacting to these foods. And we might just need to test you to find out if that's what's going on and then address it, okay? And I've also had patients tell me, no, doctor, I don't think it's food related. I've had my food allergy testing done, okay? So let's talk about that for a minute. So food allergy testing means that the doctor either did a skin prick test where they put a certain number of antigens from certain foods on, they place it under your skin to see if your skin reacted. Well, what they're looking for there is an antibody we call the IgE antibody, so that we can see if your immune system is reacting to that food, like a bad reaction that could cause anaphylaxis, right? But a lot of times your doctors have not checked you for food sensitivities. So food sensitivities is a different set of antibodies that your body makes. We call those IgA and IgG. And a lot of times those are not tested because we usually will have to draw like a panel of blood and run, maybe 180 something foods to then figure out if you have those food sensitivities. A lot of times insurance companies don't always cover those, also might be the reason why your doctor has not checked it. But it's important for us to know if that's also going on, because food sensitivities are harder to figure out. The reason is that they don't always appear right away. It's what we call a delayed sensitivity reaction, which means that if I have dairy sensitivity, for example, and I drink dairy or eat cheese or something that contains dairy, my reaction might not happen immediately. It could take up to 72 hours for the reaction to happen. So that rash might develop a week later, not necessarily the minute I drank the dairy. So that's why sometimes it's so complex and difficult to figure out which foods it is, because within 72 hours you've had 6, 7, 8 different meals. So you're not going to be able to make the association that, oh, it's the gluten or the dairy that's really causing the problem, because why? You didn't, eat it immediately around the time that the rash showed up. It might have been from a meal 3 days ago or 2 days ago. So because of this, variation and delay in the reaction, it makes it very, very difficult to figure out food sensitivity problems. But it's something that I think through, I look at with my patients if they're coming with random rashes, to really figure out if that might be the cause of what their doctor's been diagnosing as eczema, and help them to try to get better from that. Hope that helped you. If you need one of those testing done, you should reach out to your doctor and ask for food sensitivity testing. It is not just food allergy, which is the most commonly done. Food sensitivity is a different type of antibody that we're looking at. Comment in the section below if you have questions about that, and if you haven't subscribed to this channel, make sure you click the subscribe button. I'm looking. Doesn't cost anything. Click it. See you soon.